Okay, so we're going to talk about the ProSite machine and just general maintenance. So I can take the video from here, and so the main things are it's attached to the computer system, so it will alert us when the reagent kit needs to be changed. And to do that, you would just need to take this off, get the new bottles, unscrew the lids, and line them all back up again like they're supposed to be. So they're color coded. It's pretty self-explanatory. Another thing it will tell you to do is change the stain kit inside, and again, that's also pretty self-explanatory. You would just take out the old one, unscrew it, put in a new one with the colors lined up, and be set there. And then just generally keeping the machine clean and in good working order, of course. And then the amount of times to change things is kind of dependent on how much you use the machine itself. So it could be monthly, it could be every other month. It's just it'll kind of tell you when it needs to be changed, and that's the general maintenance for the ProSite machine. Okay, so we're gonna run a heartworm test, which is a type of ELISA test. So we have our blood that we've drawn in the heparinized syringe, and we're gonna put 3 drops of that into the vial. 1, 2, 3. And then we have our conjugate that will put 4 drops into the vial. 1, 2, 3, 4. And we draw the mixture up with this pipette that comes with the test and put the entire volume into the well on the test. And then we will come over here to our little machine, select our patient, Evie, and then insert it into the machine. If you don't have a machine, you can do it manually. You just wait until you can see the blood diffuse into the little window that's there, and then you would snap it down manually and wait for 8 minutes. But in this case, we'll let the machine do it, and we'll come back and read the results. Here are the results of our heartworm test. Only the control dot has been filled in, which means she is negative for heartworm. All right, so we're going to be running our modified knots test. You would want to do this if a dog comes up positive for a heartworm, for you suspect heartworm infection. So we have a 15 ml centrifuge tube of 2% formalin, and we have a milliliter of anticoagulated blood. So we're going to add that to that. And we don't have a cap for this type of tube. So we're just going to kind of gently mix it without spilling any. And then we're going to centrifuge this for 5 minutes. All right, so we have our centrifuge blood with there's a little pellet at the bottom that's formed. So what we're going to want to do is just discard the liquid on the top. And then we have our new methylene blue stain. We're going to put 1 drop in with the pellet and mix it with our pipette. And then we can draw up a drop to put on our slide. And the purpose of this whole procedure is that it concentrates the microfilaria in the sample to make them easier to see under the microscope. So we have our 1 drop, a cover slip, and then we can look at this under the microscope. So unlike with a direct smear, they'll be, if there are any microfilaria, they'll be stationary, they won't be moving. And there are other worms you could see on there. So to differentiate them, you're looking for stationary worms with a straight body and a tapered tail. So no curved tail, no movement is what you'll look for. So I kind of have it. We're going to look under the 40X and just see if we can see anything. And you want to scan a few different fields and just look for stationary parasites. And I don't see anything, which isn't surprising really because this dog did test heartworm negative, but has been treated for heartworm in the past, so it's always good to check again. And this is a good way to check and see if there's any remaining parasites. But so far I don't see anything, so we're probably good with a negative assumption. Okay, so we're going to set up a direct smear fecal test to check for parasites that may be present in the stool. So we have our little vial of saline. We'll just put a few drops on there to kind of get it started. And then we have our stool sample in a little wooden applicator. So I'm just going to grab a tiny bit to add onto there and mix it around so it kind of creates a little bit of an emulsion. And kind of, you should be able to see through it even though it has some bits in it. So I'm going to kind of push some of the larger pieces out to the edges and just make sure it's all really mixed in well. And I'll grab my cover slip I had balanced here and put that on there. And then you can bring it over to the microscope. So we're going to set up for a fecal flotation. The fecal flotation allows for a little bit easier visualization of ova that might be in the stool sample. So you want to mix the fecal flotation solution in with your feces in this little cup. And I find it easier to use a wooden applicator to kind of get an emulsion. And you can see more things with the fecal flotation than you can with just a direct smear, because as it sits, the eggs will rise to the surface and it'll be a lot easier to see, whereas with just a direct smear, you're getting a really small sample that you may not see anything even if they are positive for parasites, just because the sample section is so small. So you want to make an emulsion with the flotation solution and then filter it into your tube that's going to sit. Maybe. And really, the sample size doesn't need to be huge. Because you're going to fill the rest of it with flotation solution. I'm just going to take these off until a meniscus forms at the top. So just until it is kind of convex at the top. And then you can put your cover slip on and let that sit for 10 to 15 minutes as the ova rise to the surface. Okay, so this is our slide from our plain fecal flotation. It sat for 10 minutes while the ova rose to the top. All I did was take the cover slip off of the tube and put it onto the microscope slide. So now we're going to do a fecal flotation with centrifugation, which the only real difference is that you centrifuge your sample down, which gives a more sensitive result. So you're even more likely to see any ova or parasites that might be present just because you're concentrating your sample even more. So it's set up in much the same way. You have your fecal flotation solution in your cup, and it is easier to use one of these. And just get it all mixed up, which is fun. And then you can strain it, so you just have the pure liquid left. And again, it doesn't have to be the hugest sample in the world. I've made more than I need, as long as you get a fair amount of the liquid in there. And then you can pour that into your tube that will be centrifuged. And you want to leave a little bit of a space at the top. Sorry, try not to spill. So it'll be enough solution to yield a good sample. And so we'll go put that in the centrifuge for 5 minutes. Okay, so this is the sample for the fecal float with centrifugation that just came out of the centrifuge. So much like the other one that didn't have the centrifuge component, you just fill this the rest of the way up with your fecal flotation solution until the meniscus forms at the top. And then you have your cover slip that you can just place on there, and it will sit for the next 10 minutes. Okay. All right, so our test is sat for 10 minutes here with the cover slip on it. So all we do is take that off and we put it on our slide, and now we can look at that one under the microscope to see if we see any ova or parasites. Okay, so now we're going to set up for a sedimentation. The reason you would want to do a sedimentation reading on a fecal sample is to detect large ova, like from flukes, that wouldn't float to the surface like they will in the fecal float and centrifuging float. So we have our feces, and then for this you just need tap water. You don't need a flotation solution because you're not really looking for things to float.
Well, like I sealed the machine and then I was reading the paper in front of me.
So you can mix that. Until you have it pretty well mixed.
I would have been looking forever.
And then, again, filter. Until you have a pretty good amount filtered through. Okay. And you can pour it into your centrifuge tube. And this will be centrifuged for 5 minutes. And we'll come back and check the results. So this is the fecal sample that we ran through the centrifuge to do the sedimentation analysis. So you can see the little pellet that's formed at the bottom. We're going to pour off the supernatant. Just being careful not to get rid of our compacted material at the bottom. And then we're going to take a pipette and just kind of gently mix that a little bit and suck up what we can and put a drop of the emulsion on a slide. Apply a cover slip. And we're ready to look at that under the microscope. Okay, we're going to do an ear cytology on Neba. Neba has been head shaking and been really bothered by her right ear especially. And there is some debris in there. When you want to do an ear cytology is when you can see visible debris. In this case we can actually see pus, and I'll show that on the video as well. We want to take a cytology of both sides, even if only one side is affected, because it's good to have a comparison. So we're going to take the cytology swab from the left ear first, which is the less affected ear. I know, sorry. It's okay, you're a good dog. And you want to get down in there, not too deep, but enough to really get a good sample. And you can take some from the edges too, if there's some visible goo. And then for the left, we have our slide here. So I'm going to make just a little L, it's a gentle rolling motion, because you don't want to distort or squish the cells too much. And I just do an L for left. And now we'll take a swab from the more affected, whoops, right side. Hi. I know. Which you can see has a lot of pus. Well, maybe you can see. So it should be easy to get a sample from that. I know, Mama. A little bit. Okay, so we got it down in there. You can actually see a little bit of blood and pus on there. So that's the ear that's been bothering her. And I'll just make kind of a square for the right side because it's hard to draw an R. Okay, so we have our slide that we've made. We're going to just heat fix it. So you can just carefully hold a lighter under where you have rolled your cytology sample. And then you can wipe off the excess kind of soot there so it doesn't get all in your stain. If you can. So we'll start with the fixative. You can hold it in there for 30 seconds. So I'm just using the clock on the wall behind me to time it. Okay, so then we can take it out of that, dab it on the paper towel, put it in the next stain for another 30 seconds, and then we can take it out of there after 30 seconds and put it in the last one. So then we can take it out of there after 30 seconds. You can rinse with a little bit of distilled water. You can rinse the front and the back. And then you can either prop it up to air dry or dry it using this absorptive paper and just kind of gently pressing on it. So once your slide is dry, you can bring it over to your microscope. You can always start on low power. And remember, on this one I have the left on the left drawn in an L and the right ear, which was the more affected ear, on the right side in a square. So you can kind of start on a low power objective. I'm going to start on the 10x objective and focus in. And on the lower power field, you can look for things like ear mites or any like kind of external parasites that you might be able to see on a low power. And then you can zoom in 40, refocus, and look for large clumps of things that you could really hone in on when you get to an oil immersion layer. So then you can get your immersion oil and use the highest objective. And on the highest objective, you're going to look for things like bacteria, yeast, and other cells that might be present that would be abnormal and indicative of different types of ear infections. So we're going to do a fungal culture on our friend Cash here. His owner is suspicious of ringworm. He has a few little lesions on here, and clearly, yeah, you can kind of zoom in on those that have been irritating him. So the indications for wanting to do some fungal testing would be obviously skin lesions like this flaky area, as you can see, the broken hair shafts. So we can take, we're going to take samples from the edges of the lesions and from a few different ones, and we'll put it into our DTM medium. So just take a good sample from the periphery, and we'll get some from a few different lesions as well. And we have our medium ready. It's DTM medium. We should have our results in 3 to 5 days. If there's any color change or growth, we'll see that soon. And you want to leave the lid loosely on there, not all the way down, so that there's some oxygen that can enter. And so we'll be checking on that later. So we did our DTM a few days ago. It did start changing color, so you want to do a microscopic evaluation. The lid was on loosely. I had it on tighter just to hold on to it. So I have my little swab with a piece of clear tape on it. It's a little bit harder with the cylindrical collection, but I'm just going to roll on the top there to pick up some of the colony that's grown. Take it back out. And then I have my slide here with the cotton blue stain. So I'm going to take the edge of this and put what I've managed to roll off onto the stained portion of the slide. And that kind of acts as its own cover slip. And then we can come over to the microscope. I have it on the 10x objective, and we're just going to look to see if there's any visible dermatophytes in the culture. So you're looking for a little segmented kind of canoe-shaped organisms. And I do see a few, so it looks like we have a positive result. All right, so we have Red here who will be doing a skin scrape on. So reasons you would want to do a skin scrape would be to look for parasites that you can't just see with your naked eye typically. So things that burrow, such as Sarcoptes mange or Demodex mites. Indications would be, itchiness, hair loss. So we have our 10 blade here and a slide prepped with mineral oil. I'll just put a little bit of the oil on the blade itself. And then I did a little clip of the area. You want to take your scraping from the edge of the lesion, which is right there, and kind of try and get a few different spots, but just, important to not actually cut into him. We're just scraping enough to try to get a little tiny bit of just capillary blood, because like I said, the Demodex and the Sarcoptes can burrow under the hair follicles. So you'd want to get enough so that you can. Oh, little buddy. You can kind of squeeze it. Yeah, you're tough. Okay, there's a little bit oozing out there. And then you add that to the slide. And then I'll try and, since he's being so good, do one more on the lower part of the lesion, just so we have a couple different sites. You're doing so good, little buddy. Okay. And that's good. We'll put that on our slide. Whoops. A little bit fall off, but I think we're good. And get that up in the middle. And we'll get a cover slip and put that on. We can separate one. And so what we're going to look for, there's a few different kind of mites we could potentially see. Demodex kind of have the long carrot-shaped bodies, and Sarcoptes are more round. But it's pretty obvious when you see one, and you can use a pretty low power objective to look and just scan a few fields. You might also see like eggs in the hair shafts of different mites. So all things to look for while you're looking. So far I don't see anything on Red's slide, but at least we know what to look for, and we'll keep searching. So we're here, we're going to do a necropsy on these two mice. They were owned by the same person and they died of unknown cause. So the reason for necropsy is to help definitively find a cause. And we have Dr. Judd here to perform the necropsy.
Hi, we've got, I'm going to totally forget their name, Lily and Rosie, who are two-year-old mice that passed about a week and a half ago abruptly, and the owner wanted us to look for internal causes. Lily does have two ulcerated masses. I'll lift this up so you can see it on her back. The other one doesn't have any external pathology. There's one here. Oh, I lied, just one. And then there's a little one that's right here. But those are the only abnormalities externally that they have. The other one doesn't have any external abnormalities. And so the cause for necropsy is just to make sure that there was nothing internal. Now these mice are geriatric, and so they could have died from natural causes. It's just a little bit obscure that they died at the same time. So we're going to make sure that there's nothing contagious, because she has other mice as well. So we're going to start with Lily here. And so we make a midline incision. Usually you would start with just the abdomen, but because these guys are so small, I'm just going to make one long longitudinal incision. And you can see off the bat she does have some ascites and kind of some billowing. Unfortunately, these guys did sit in a freezer for about a week before they were thawed and brought in, so some of this could be post-mortem change as well. Not what I want. And so just a lot of gas distension right off the bat. These are all gas-filled intestines. Again, this is probably a post-mortem change because they sat for so long. You definitely want to make sure you're wearing appropriate PPE, mainly because, you know, they do sometimes have transmissible diseases that we can get. I'm going to go ahead and just extend this incision with my scissors. The owner was a little bit concerned about foreign body. And it does look like we actually have a perforation in here. Because there's some gut contents that are just sitting on the inside here that shouldn't be. Our liver looks normal. Our stomach is very distended here. And so we'll go ahead and open that up.
I don't know if you need me to hold anything up so you can make an incision a little easier or anything.
I'm going to take these forceps and hold this up right here. Thank you. And so we're going to take a little sample of this stomach as well. Oops. I'm going to go ahead and switch instruments with you. Hold on. Okay. Thank you. And so there's some definite material within the cardia of this and down in the pylorus, but there's no true obstruction sitting there. As we go down our little tract here, really there doesn't appear to be any obstruction. Now with the perforation and things down here, that doesn't seem to be the case. It does look like there is some sort of change. Again, this is probably post-mortem change because they sat for so long. There's one kidney, right? More lobes of our liver. Diaphragm looks okay. So we're going to take a little sample of his stomach to send out for pathology. You can let go. You can let go. Really, you don't want to damage any tissue. So with these, you want to just take really no sawing or anything like that.
Okay, so I pre-labeled the container with her name and the date. And we'll just put the location of the biopsy on the label as well. So that's our stomach.
The remainder of this looks okay, but I'm going to take a little section of our liver as well.
Just going to write stomach on this one for Lily Ford. And then
like I said, the remainder of this necropsy looks fairly normal. Open up their chest cavity just to make sure we don't see anything in here, which I'm not anticipating to. I'm going to this for a second. And with these little guys, she does have some atelectasis, which is essentially when the air leaves the lungs, they kind of shrivel they have this weird change. She does have some nodular change to her lungs, so we would actually submit some of this as well.
Okay. I'll grab another.
Well, what we can do is save this, and we'll just put it in a tube afterwards since we only grabbed 2 jars.
Okay.
We'll just leave that there until we're ready.
Sounds good.
But yeah, and the rest of this, like I said, looks fairly normal. Her heart looks good and everything else. So those would be the samples that I would send out for necropsy. We're going to repeat this process for the other one, and then close her up, and the owners are going to come get them for burial.
Okay. So that's our necropsy for Lily. Okay, so we're going to talk about rabies suspect handling. Who can handle a suspect would be generally just a veterinarian or a licensed veterinary technician. Potentially someone who is vaccinated against rabies could handle it, but obviously you just want to keep any handling to an absolute minimum number of people. You would need to wear gloves, gown, face mask, goggles, all protective equipment. Since it is zoonotic, obviously you would really want to protect yourself. The only thing that needs to be submitted to the health department is the head, unless it's a bat or a really small rodent. In that case, you would just send the whole animal. In Texas, they want the head sent to them on ice packs, but not frozen. So it just needs to be kept cold, basically, in a double Ziploc container, inside a rigid container, inside another box, and labeled with a Category B label. And then the remainder of the body can be disposed of via cremation. Okay, so we're going to be doing our vaginal cytology here on Miss Raven. The first step is you'll want to clean the area that you're going to be placing the swab. So you can kind of pull down on her vulva just a little bit and give it a gentle wipe with a Chlorhex wipe. And then we have our swab that's sterile, that I just want to moisten with some saline. And then you kind of insert, and you go up at a pretty steep angle.
Good girl. I know, that's weird.
For further than it feels like you should, about 2 inches or so. And then you can kind of switch and go at about a 45-degree angle and just give it a gentle little roll.
It's okay.
And pull that back out. And then I have my slide. I'm just going to gently roll the sample across the slide. We'll do a couple lines just to get a good reading. And you don't want to push down, just a gentle roll. And then we'll wait for this to air dry and we'll stain it and take a look under the microscope. Okay, so our slide is dry. So we're going to stain it now. You just want to place it in the fixative first, and you can place it in there for about 30 seconds. And then we'll put it in the first stain for 30 seconds. And now we can move it into the last stain for 30 seconds. And now we can take this out of the stain. It's been 30 seconds.
Come on, Scary Larry.
And we can just rinse it with distilled water. Okay, so we have our slide stained and dried, and we're going to look and see what cells we can see to determine what stage in the heat cycle this dog would be in. Although this is actually a spayed female, because we don't have a lot of dogs coming in for vaginal cytology smears, but we can look and see and make sure everything looks good in there. So she would have the same cells visible as a dog would be if they were in anestrus or diestrus, because she's not going to have a heat cycle. So I do see, just various squamous epithelial cells, some larger than others. There's a few kind of larger intermediate cells, mostly kind of the parabasal epithelial cells with the kind of basophilic cytoplasm and the nice rounded nucleus. I saw, 1 or 2 neutrophils as I've been kind of scanning through the slide, which isn't uncommon in this stage. So looks like a normal cytology smear from a dog that would be in anestrus. So we talked about anestrus while I was looking under the microscope. You'll see mostly non-cornified epithelial cells. So that's anestrus, and then the next phase would be proestrus, which is when there will be some vulvar swelling. There may be some reddish discharge coming from the vulva. The males will be attracted to the female, but she won't allow them to mate with her. She won't stand for them. Microscopically, you'll see still a lot of the squamous epithelial cells, mostly the non-cornified ones. You'll see them kind of transition into be more of the intermediate with some of the pygnotic nucleus will have the condensed chromatin in it. And you'll see a lot more red blood cells, or you'll see red blood cells at all. So that would be a sign of proestrus. As you get into estrus, all of the epithelial cells are going to be cornified, so they're not going to have a nucleus. They will be sort of angular shaped instead of the kind of amorphous shape that they normally have. So sharp angles and no nucleus, and that'll be the epithelial cells you'll see. You'll still see some red blood cells. You won't be seeing any neutrophils during estrus. The vulva will be swollen. There may be a sort of whitish, clearish discharge coming from the vulva, and the males will be attracted and they will mate at that time. Directly after estrus is met-estrus or meta-estrus, where there will be a surge in neutrophils right after that. So for the first 3 days, you'll see a lot of neutrophils microscopically, and the cells will start transitioning back into being the non-cornified squamous epithelial cells. You'll start seeing the basal, parabasal, squamous epithelial cells again. And then as that continues, it becomes difficult to distinguish between meta-estrus and anestrus. But yeah, that's the main differences between all the stages of the heat cycle in the female dog. All right, so we're going to be running our cross-matching test to see if our donor and recipient pets are a good match for a blood transfusion. So we have 2 sets of blood drawn here. We have a recipient in a serum separator and the recipient in the lavender top tube, and we have the donor in their same tubes. So we just need to centrifuge the blood down, and then we can separate off the plasma and serum. So we'll just line these up so that they're balanced. Okay. And we'll come back in 15 minutes. All right, so we have spun down the red top tubes, or the serum separator tubes. So we have our donor tube. We're just going to pipette off the serum from that and put it in the labeled donor plain tube. And that can sit until we're ready. Look at that. And we'll get a new pipette for the recipient serum, pipette that off, and put that in its labeled red top tube, and we'll let that sit while we do the rest. Okay, so we have our purple top tubes that have spun down, so we just need to get rid of the plasma. And we'll use 2 separate pipettes to not cross-contaminate. Okay, so those are ready to start being washed. Okay, so now we have our red blood cells for our donor that we're going to just take a couple drops and put them in the donor tube. There's 2 drops in there. And our recipient, two drops into their tube. And we're going to fill each tube up with sterile saline, which I have here. And this will be our first erythrocyte wash cycle. So we're going to centrifuge these for just 1 minute, and then we'll repeat the process. Okay, so we've done our first wash, or we've centrifuged our first wash sample. So we're going to discard the supernatant for both the recipient and the donor. Just pop that there. And now we have our blood left in here. And we're gonna just fill these back up again. This is our second time. We're gonna just fill it back up with saline. And we'll centrifuge them for another minute. So now we've spun down our second washing of erythrocytes. So we're just gonna repeat the same process. Discard the supernatant on both. Careful not to disrupt too much of the blood cells in there. And then fill it back up with saline for the third time. And gently mix, and another minute in the centrifuge. All right, so we've done our final washing of the erythrocytes. I have here 0.02 mils of the donor's packed red blood cells and 0.02 mils of the recipient's recipient's packed blood cells. So the donor one, I have my labeled tube. I'm gonna put 0.2, actually, I'm gonna put the saline first. So I have 0.98 mils of saline that I'll put in the tube to make our suspension. And then add the donor, which I have labeled on the end of the syringe, to that. So now we have a 0.02 dilution. And we have our saline and packed cells for the recipient. Here's our recipient syringe of red blood cells. So now we have our suspension ready to be tested. Okay, so we have our cell suspension made, we have our serum ready, we're ready to actually perform the cross-match procedure at this point. So we have a tube labeled major for the major cross-match. So that's going to be 2 drops of the recipient's serum. Two. Mixed with 2 drops of the donor's washed blood cells. Okay. And then we can let that sit for 30 minutes at room temperature. That's our major cross-match. Our minor cross-match is going to combine the donor's plasma with the recipient's washed red blood cells. So same thing, 2 drops of each. 1, 2. And 2 drops of the donor plasma. Okay. And so the major and minor cross matches can just incubate at room temperature for 30 minutes and we'll come back. Okay, we also need to make our controls so that we know that the results are reliable from our cross match. So I have our recipient control tube and our donor control tube. So we're just mixing the washed red blood cells and the serum from the recipient together to put in a tube, and likewise from the donor. So I have our recipient washed red blood cells. We'll put 2 drops in the recipient control. And our recipient serum. We'll put that in the control. And then we'll do the same for the donor. So we've got our donor blood cell suspension, 2 drops in there, and our donor serum, 2 drops there. So a gentle mix, and we'll come back and check all of them in 30 minutes. All right, so it's been 30 minutes and we can now spin all of our controls and the major and minor cross match for 1 minute in the centrifuge. So balance them all out. And we'll come back in a minute. Okay, so we've taken all of our tubes out of the centrifuge. The controls look good. There's no evidence of hemolysis. If you tap them, there's no signs of the cells agglutinating. So the controls seem good. This should be a reliable result. We have our major cross-match here. There's no evidence of hemolysis. You can tap it and see if there's any evidence of cell clumping. And I can't see any macroscopically in the major. We have our minor too. Again, no hemolysis. And when I go to mix it, I don't see any macroscopic evidence, but it's good to look microscopically. So we have our major and minor slides here labeled. We'll just take one drop of each and put it on the slide to evaluate under the microscope. So one for major and one for the minor. And, oops, don't roll over that. So we'll take it over to the microscope. We'll apply cover slips to each. So, you can use a pretty low power objective for this. You don't need to really get close. You just are looking for general cellular clumping. So focus it in, and you can bring the condenser down a little bit so it's not quite so bright. Let's see if I can get it focused here. And in looking at this, I'm going to go ahead and go up to the 40x objective just to see a little bit better. Yeah, I don't see evidence of any agglutination. The cells are all pretty evenly dispersed across the slide. So in that case, if the cells aren't clumping together, there's no hemolysis happening, then these should be compatible blood transfusion partner dogs. So we'll take our major crossmatch off, and we'll just look at the minor, even though it's not necessarily as important, especially since we have a good result for the major crossmatch. So focus in. I'm going to switch again to 40x just to get a better sense of what's going on there. And again, yeah, no signs of any clumping, and you know, you want to make sure not to confuse rouleau or with actual agglutination, but I don't see anything like that. Everything looks pretty evenly covered, so I think these guys are a good match.